Hi everyone, this is Ms. Romani, and during this lesson, I will help you find a way to prevent illness, to feel healthier, to look better, and even to slow the aging process. Sound too good to be true? Well, it isn't, because today we're learning about vitamins. Of course, you've heard of vitamins, but let's talk about what they are, what they do, and how they are classified. Vitamins are organic molecules, ones that we need to eat in order to stay healthy, so they are essential nutrients. But we only need to consume very small amounts of each vitamin, so they're classified as micronutrients. I'm sure that since you were little, you've heard that vitamins are important. But have you ever wondered why? What exactly do vitamins do? And why do we need them to stay healthy? Most vitamins act as something called coenzymes. This means that they complete the structure of an enzyme so that the enzyme can catalyze a chemical reaction. Let me explain. Enzymes help chemical reactions happen in the body. Every chemical reaction needs to have an enzyme to help it along. And enzymes have this section called the active site, where the reactants of the reaction can fit and so that the enzyme can catalyze the reaction. However, some enzymes have incomplete sites, so that means that the reactants cannot fit onto the active site as it is. And this is where vitamins come in. Different vitamins can complete the active site of enzymes so that they can attach to the reactants and allow the chemical reaction to take place. So these vitamins act as coenzymes. What this means is that without vitamins, several hundred different types of chemical reactions would simply not take place in the body. Some of these vitamins help chemical reactions involved in, say, energy production, or our immune health, or the proper absorption of nutrients, just to name a few. Another big function of vitamins in our bodies is to act as antioxidants. Antioxidants get rid of specific molecules in our bodies called free radicals that can damage cells through a process called oxidation. So let me explain. Free radicals are unstable atoms that can damage cells. This damage is called oxidative stress, and it can speed up the signs of aging and may even be responsible for many life-altering and life-threatening diseases. So, where do these nasty free radicals come from? Well, actually, from our bodies. Well, they are formed in our bodies. Free radicals are unstable atoms. If you remember from grade 9 chemistry, atoms have electrons that orbit the nucleus in layers called shells or orbitals. Atoms with an outer shell that is completely filled with electrons are stable. When atoms lose an electron, they can become unstable free radicals. And these unstable free radicals seek other atoms or molecules to bond to. If this continues to happen, it can begin a process called oxidative stress. So, what causes this free radical formation? Well, free radicals are formed from a wide variety of factors, like, for example, a poor lifestyle, like eating a poor diet, or smoking, or taking drugs. They can also be caused by stress and by illness, or by exposure to pollution, or exposure to UV radiation. But what makes free radicals so damaging to our cells is that once they form, they can steal electrons from other atoms, forming more free radicals, causing a chain reaction of oxidative damage and disease. So then, how do vitamins help? Well, vitamins act as something called an antioxidant. And an antioxidant basically prevents the effects of free radicals by donating an electron to the free radicals. And by doing so, they reduce their reactivity and basically they reduce oxidative stress. And what makes antioxidants unique is that they can donate electrons without becoming reactive free radicals themselves. Now, no single antioxidant can combat the effect of every free radical. Just as free radicals have different effects in different areas of the body, every antioxidant behaves differently because of its chemical properties. So, which vitamins act as antioxidants then? A few of them do. But in particular, vitamin C, vitamin E, and beta carotene, which gets converted into vitamin A in our bodies. So let's talk about specific vitamins then. But before we do, let's talk about how they are classified. There are 13 essential vitamins that we need to consume to stay healthy, and they come in two general types or classifications: lipid soluble vitamins and water soluble vitamins. The difference between the two types determines how our body can absorb them from our food, and whether or not we can store them in our bodies. There are 4 fat-soluble vitamins: A, D, E, and K. These vitamins can be found dissolved in fat and are often found in foods that have a higher fat content, like, say, nuts or avocados or milk. Because they are not easily dissolved in our blood, fat-soluble vitamins need special courier proteins to attach to them in order to move them through our blood. However, since they can dissolve in fats, fat-soluble vitamins can actually be stored in our body fat. So if you consume a little bit extra vitamin, the extra will be stored in our body fat until you need it. The one drawback with that is that other than using them for their intended purposes in our bodies, we have no way to get rid of them. So overconsumption of these vitamins can actually cause them to accumulate to toxic levels. This is usually not likely to happen through eating vitamin-rich foods, but can actually occur if you take too many vitamin supplements. On the other hand, we have 9 water-soluble vitamins: vitamin C and the 8 different B vitamins like B12 and B4, for example. The water-soluble vitamins, as the name implies, are able to dissolve in water. That means that they can easily be absorbed and dissolved into our bloodstream. On their own, there's no need for carrier proteins. And unlike fat-soluble vitamins, though, any extra vitamin you don't use each day is actually removed by our kidneys and excreted in our urine. In other words, we pee them out every day. This means that we need to make sure that we get enough of the water-soluble vitamins daily. So for this next section, we will focus on some specific vitamins you need to know about. We will cover all 4 fat-soluble vitamins, vitamin C, and a couple of the B vitamins. Keep in mind that even though I will give you a lot of information about the functions in some of the foods that are a good source of each vitamin, this is only a glimpse, and each vitamin has way more functions than those listed and can be found in a greater variety of foods than I can possibly name in this lesson. Having said that, some of the functions and foods are underlined in the lesson, so I did this to make it easier for you to study for your test. So you'll only be tested on the underlined information. So let's begin. Vitamin A. Vitamin A is an antioxidant that is important for normal vision, a healthy skin, and a proper immune system. When it comes to the skin, vitamin A has also been known to clear up acne. For example, a topical or a cream form of vitamin A called retinol is sometimes prescribed for severe acne. Retinol is also used to reduce the appearance of wrinkles. Vitamin A also helps with the heart, with lungs, with the kidneys, and with other organs, and make sure that they work properly. So, what types of food are a good source of vitamin A? Well, since vitamin A is a fat-soluble vitamin, foods that tend to be high in vitamin A are mostly liver and organ meats, as well as some fatty fish like salmon and tuna. Milk also contains vitamin A. However, the most well-known source of vitamin A are carrots. Carrots are high in beta-carotene, which our bodies convert into vitamin A. Green leafy vegetables and other green, orange, and yellow vegetables such as broccoli and squash are also good sources. So what happens if we don't get enough vitamin A in our diet? When we don't get enough of a particular nutrient, we can end up with something called deficiency. A deficiency is a disease caused by a lack of a very specific nutrient. Vitamin A deficiency is very rare in Canada, but is actually common in many developing countries. The most common symptom of vitamin A deficiency is in young children, and it's an eye condition called xerophthalmia. The xerophthalmia is the inability to see in low light, and it can actually lead to blindness if it isn't treated. It can also lower our ability to fight infections. So let's talk about vitamin D. Vitamin D is needed for immune system health and to maintain strong bones and teeth, which it does by helping the body absorb calcium from our food and from maybe supplements that we might take. As far as for the immune system, vitamin D seems to have a large influence in preventing what are called autoimmune disorders. And these are disorders during which our own immune system fights our own body cells. And vitamin D also can help us with fighting invading bacteria and viruses. Actually, recently, vitamin D deficiencies have been tentatively linked to worse cases of COVID-19 infections. So, health authorities are starting to recommend vitamin D supplements, especially for people who are stuck indoors. And that is because the easiest way we can get vitamin D is from the sun. They say that about 15 to 20 minutes, 3 days per week, is usually sufficient to get enough vitamin D from the sun. That is because vitamin D is the only vitamin that our bodies can actually produce, but it can only be done with sun exposure. So what happens is that when your skin is exposed to sunlight, it makes vitamin D from cholesterol. The sun's ultraviolet B rays, so the UVB rays, hit the cholesterol in the skin and provides the energy that is required so that your bodies can synthesize vitamin D from that cholesterol. Now, being exposed to sunshine from indoors, like through a window, will not actually lead to vitamin D production. So you kind of have to go outside to get it. Also, cloudy days or staying in the shade or even having dark skin color can cut down on the amount of vitamin D that you can make from the sun. So people with darker skin who live in Canada in the winter may need to take vitamin D supplements or make sure that they eat a vitamin D rich diet in order to get enough vitamin D. So, fatty fish such as salmon and tuna are among the best food sources of vitamin D. But almost all Canadian milk supply is also fortified with vitamin D, and so are many of the plant based alternatives such as soy milk or almond milk or oat milk. Um, but foods that are made from milk directly, like cheese or ice cream, they're not fortified. In case you don't know, fortified means that vitamins or minerals are artificially added to certain foods. So, vitamin D can be added to certain foods, like, for example, milks, but it can also be added to breakfast cereals. And even some brands of orange juice have had vitamin D added. Just check labels and you'll be able to see whether or not a food has had vitamin D added to it. And you can stick to those foods. So, people who get too little vitamin D may develop soft, thin, and brittle bones, a condition known as rickets in children and osteomalacia in adults. In children, vitamin D deficiency causes the bones to become soft and to bend. So, this is what's happening in this picture right here. It's a very rare disease, but it still occurs when infants or children do not get enough vitamin D. In adults, vitamin D deficiency tends to lead to, like I said, osteomalacia, which is a disease that causes bone pain and muscle weakness. Recent studies have also shown a link between vitamin D deficiency and depression, as well as autoimmune disorders like multiple sclerosis. And let me be clear, vitamin D deficiency may not be the cause, but a correlation has been found. So, for example, in one study, people with depression tended to have lower levels of vitamin D than those without. And in other studies, they have shown that vitamin D levels were also low in people suffering from multiple sclerosis and other immune disorders, and as well as infections like COVID-19. So far, the conclusion seems to be that maintaining adequate levels of vitamin D may have a protective effect and lower the risk of developing those immune conditions. And that is why having low levels of vitamin D can be linked to those conditions. So, let's talk about vitamin E. Vitamin E helps to widen blood vessels and to keep blood from clotting within them. It is also a strong antioxidant, helping to protect cells from the damage caused by free radicals. It also boosts our immune system so that it can fight off invading bacteria and viruses. In addition, cells use vitamin E to interact with each other and to carry out many important functions like maintaining the cell membrane or making red blood cells and maintaining most organs. Avocados, nuts such as peanuts, hazelnuts, and especially almonds, and seeds like sunflower seeds are amongst the best sources of vitamin E. Green vegetables such as spinach and broccoli also provide a good source of vitamin E. And vitamin E deficiency is actually very rare in healthy people. It is almost always linked to a disease in which fat is not properly digested or absorbed. Like, say, for example, someone with Crohn's disease or with cystic fibrosis might be more likely to suffer from a vitamin E deficiency than someone who's healthy. And that is because vitamin E is actually one of the vitamins that actually needs some fat for it to be properly absorbed into our digestive system. Vitamin E deficiency can cause nerve and muscle damage when it occurs, and that results in a loss of feeling in the arms and legs or loss of body movement and control. It can also cause muscle weakness and vision problems. Another sign of deficiency is a weakened immune system. So, vitamin K is mostly important for blood clotting as well as for protein synthesis. but it also has other functions in the body, like, for example, keeping our bones healthy. People taking blood thinners, as a matter of fact, are sometimes told to take a vitamin K supplement because since vitamin K is important for proper blood clotting, if you're on blood thinners and you don't have a proper amount of vitamin K in your body, like if you're deficient of vitamin K for some reason, then that might make wound healing extremely difficult. So, one interesting thing about vitamin K is that it is actually produced by some bacteria that live in our colon. So we not only can get it from foods that we eat, but we actually, well, not necessarily produce it ourselves because the bacteria, although they're in us, they're not us. But it is produced inside our bodies by these bacteria that live in our gut, that live in our large intestine. And they produce the vitamin K and then secrete it. And we're able to use that vitamin K and then absorb it from our large intestine into our bloodstream. But there also are food sources of vitamin K, like mostly actually green vegetables like spinach and kale and broccoli. Liver and milk are also good sources of vitamin K. Vitamin K deficiency is actually not that common in Canada. Most people in Canada get enough vitamin K from the foods that they eat and or from their gut bacteria. However, when it does happen, severe vitamin K deficiency can cause bruising and bleeding problems because the blood will take longer to clot. Vitamin K deficiency also reduces bone strength and can lead to improper bone formation in newborns. So, that's it for the fat soluble vitamins. Now, let's move on to some of the water soluble vitamins. Vitamin C is probably one of the most well known vitamins. In the body, it acts as an antioxidant, helping to protect cells from the damage caused by free radicals. The body also needs vitamin C to make something called collagen, which is a protein that is required to help our wounds heal. In addition, vitamin C helps the immune system work properly to protect the body from disease. So, a lot of people will have heard about vitamin C because whenever they get a cold, you probably have someone who has told you, oh, you should take in more vitamin C because it'll help you get better faster. I don't know if that's true or not. Vitamin C does help you heal from diseases faster in general, or at least it keeps your immune system healthy. So it never really hurts to take a little bit of extra vitamin C if you're not feeling that well. And you may already know that citrus fruits such as oranges and grapefruits and lemons and limes are a great source of vitamin C. Juices of those fruits are also a good source of vitamin C. Another great source are kiwis, as well as red and green peppers. And some other fruits and vegetables are also good sources of vitamin C, like broccoli or strawberries or tomatoes. Notice that there are no animal products that are a good source of vitamin C. And so, vitamin C is one of those vitamins you can really only get from fruits and vegetables, mostly fruits, but a few vegetables as well. And vitamin C deficiency can cause a disease called scurvy. And it's very rare in Canada today because you would need to get little to no vitamin C for many weeks in order to get scurvy. And this would require not eating fruits and vegetables for months, something that would only happen in extreme circumstances nowadays. This disease was actually quite common in the 15th and 16th century amongst pirates and sailors that would spend months abroad aboard ships on the ocean and would have limited or no access to fresh fruits and vegetables for the time that they were at sea. And scurvy causes fatigue and inflammation and bleeding of the gums. Oh, it also causes small red or purple spots on the skin. It causes joint pain. It causes your wounds to not heal very fast. And additional signs of scurvy would include depression and anemia, as well as loosening and the loss of teeth, probably from the gum issues. And unfortunately, scurvy is and was fatal if it is not treated. But the treatment is simply vitamin C. Now, another water soluble vitamin is vitamin B12, one of the many B vitamins. B12 helps keep the body's red blood cells healthy and it helps make DNA. Vitamin B12 is naturally found in animal products, including fish, meat, chicken, eggs, milk products, beef, basically any animal product. Vitamin B12 is generally not present in plant foods, so people who avoid all animal products, including milk and eggs, like so vegans say, would need to get their vitamin B12 from fortified breakfast cereals, so breakfast cereals that have had vitamin B12 added to them, or vitamin supplements. So, vitamin B12 is kind of like the opposite of vitamin C in terms of their sources. Vitamin C comes only from fresh fruits and vegetables, whereas B12 comes from animal products. And even though most people in Canada do get enough vitamin B12 in some way or another, some people have trouble absorbing vitamin B12 from food. So they might get it in their diet, but they cannot actually absorb it from food. And as a result, vitamin B12 deficiencies actually affect between 1.5% to 15% of the public. And vitamin B12 deficiency causes a type of anemia called megaloblastic anemia. And this type of anemia causes tiredness and weakness and constipation and loss of appetite and weight loss. It also causes nerve problems such as numbness and tingling in the hands and feet. And other symptoms might include a loss of balance or depression or confusion and poor memory, as well as soreness in the tongue and mouth. And finally, I want to talk about folate or folic acid, which is also a B vitamin. And the reason I chose to focus on folate as opposed to any of the other vitamin Bs is because it is extremely important for women to maintain healthy levels of it before and during pregnancy. Now, all of us need folic acid or folate in our bodies in order to make DNA or to make our other genetic material. And we also need it in order for our cells to divide properly. But women in particular, or women who become pregnant or could become pregnant or are pregnant, in particular, need folate or they need to take a supplement called folic acid in order for their babies to develop normally. Folate is naturally present in vegetables, especially green vegetables like asparagus or Brussels sprouts, or dark green leafy vegetables like spinach or mustard greens and kale. Oranges, nuts, lentils, beans, especially kidney beans, and black eyed peas are also a good source of folate. So, a woman who gets pregnant must have enough folate or folic acid in their bodies by the early weeks of pregnancy in order to prevent spina bifida. And because many women don't discover that they're pregnant until past that time when folic acid is needed the most, doctors recommend that all women who may become pregnant should take a daily supplement of folic acid or make sure that they eat a diet that is very rich in folate. And you need to make sure that you get enough folate in your diet every day because this is a water soluble vitamin, which means that we don't absorb extra folic acid or folate in our body for the future. We need to take it in every day. And so, although folate deficiency is rare in Canada, the risk of spina bifida due to improper nutrition during pregnancy is just too great to take a chance. So, what happens with spina bifida is that a baby's spine and or spinal cord is just not formed properly. And symptoms of folate deficiency can also occur in adults. It's not just for developing babies. And symptoms of folate deficiency in adults are usually an irritated tongue and the weakness and fatigue and other symptoms that are due to megaloblastic anemia, which is the same type of anemia that is caused by a B12 deficiency or the inability to absorb B12 into the body. And so that's it for our lesson on vitamins, guys. I hope that this lesson inspired you to eat more vitamin rich foods, especially green vegetables, fruits, nuts, seeds, dairy, beans, salmon, many of the vegetables and fruits that I mentioned throughout this lesson. Some of them repeated themselves, so it goes to show you that those are actually very good sources of vitamins. And if you feel that you are not getting enough of a particular vitamin, like say for example vitamin D, go ahead and take a vitamin supplement. Just don't take too much. Just take the recommended amount. All right, guys, I'll talk to you soon. Bye.